My name is Cécile Bataillé. I am an associated professor in the orthopedic department at Croix-Rousse Hospital in Lyon, in France. I'm talking to you about our JBJS article, Tibial Tubercle Osteotomy in Revision Total Knee Arthroplasty for Periprosthetic Infection. My colleague and I have performed this study because very few data in the literature describe the outcomes after TTO in a septic revision. Tibial tubercle osteotomy can be very helpful for complex revision of TKA to improve the exposure, but its safety during septic revision could be compromised. The risk of septic complication, like a septic non-union of the tibial tubercle, could be very high, compromising the relevance of TTO in a septic revision. That's why we wanted to assess the outcomes and complications after TTO in a septic revision. For that, we evaluated 68 patients with a TTO during a septic revision at a minimal follow-up of 2 years. And surprisingly, we didn't report septic complications related to the TTO. Indeed, we found 10% of complications due to TTO, but not related to the infection. It was mainly aseptic tibial tubercle fracture and aseptic non-union, with only 3% of revision and 97% of bone union. But the rate of infection recurrence was high. It was 26%. So the risk of complication related to the TTO or related to the infection independently was significant. But the combination of both infection and TTO didn't increase the risk of complications and revisions. So, if you perform a complex septic revision of total knee arthroplasty with a very difficult exposure, we recommend, after this study, to do a TTO to facilitate the surgery and to decrease the surgical time and the other complications, particularly the complication on the extensor mechanism.